I wish to acknowledge the Duck and Jung people as the traditional custodians of the land on which I work. I pay my respects to the elders past and present and recognise the continuing connection and contribution to the land. Welcome back to MatterofVax. This week we're joined by Professor Tom Snelling. Tom's a Director of Health and Clinical Analytics in the School of Public Health at the University of Sydney and an infectious diseases physician in the Sydney Children's Hospital Network. He's working with a range of collaborative research groups across a diverse clinical domain. He's an incredible worker in the area of whooping cough. Please welcome Professor Snelling.
Thank you, Steph.
This morning, we're here to talk about a compelling disease, pertussis, or whooping cough, as perhaps it's better known. It's a bacterial infection that can lead to pneumonia, brain damage, and sometimes death. It's especially serious for babies, but can affect people of all ages. We've had a resurgence of whooping cough. Why is that?
We've had a resurgence in the past few months, but before that, we'd actually had quite a good period over a number of years. What we think happens is whooping cough is essentially always with us, that the bacteria is always present in the community, but most of the time it doesn't cause any problems. And that's because most people have immunity or protection against the toxins produced by the bacteria. And that immunity is produced both by vaccination, but also by infection. After a certain length of time, when there isn't a lot of infection in the community for several years, the population's immunity to those toxins starts to wane. And so when people are infected, we start to see symptomatic infection. For most people, the symptoms are often quite mild, and sometimes they might not even know they've got whooping cough. They might just have a coughing illness that lasts for several days or a couple of weeks, and they may never be tested. The real problem is when very young children in particular who don't have any immunity become infected in one of these waves, because it can be a very serious infection if you've got no immune protection at all. And because we haven't had much circulating infection over the past 5 or 6 years, the population immunity has waned over time. And so we're just entering into a new phase where there are quite a few people now who are susceptible, and there's enough people to allow the bacteria to be transmitted and for us to start to see some really sick kids.
What are the symptoms of whooping cough and how do we tell the difference?
So sometimes whooping cough can have no symptoms at all. In fact, that's probably the most common thing. People who've been immunised but had the infection in the past will often not have any symptoms at all. A lot of people will have a coughing illness, especially older children and adults who have been immunised if they have the infection. And one of the characteristic things about whooping cough that makes it a little different from other viruses and other bacteria is that the coughing illness that it produces tends to be persistent. And so the kids and adults who we suspect whooping cough are often people who've had a coughing illness for a number of days. So most viruses you will resolve within a few days or a week, but often whooping cough tends to persist with the coughing even several weeks or even longer. In some kids, it can be confused with asthma because asthma also causes persistent coughing. But in young children who are not fully protected from vaccination, so this is especially babies before they've received their first dose of vaccine, so babies under a couple months old, or babies who have only had one dose in particular, so this is babies below about 6 months old, when they get whooping cough, they can get what we call classic whooping cough, which is the sort of whooping cough we used to see before there was vaccination. And those babies and young children often start with what we call catarrh, which just means essentially a runny nose, like a head cold type symptoms. And then the coughing starts. And the coughing is very typical. It's what they call paroxysms of coughing, which essentially means a fit of coughing. So these babies, and if you've seen videos or ever had the misfortune of having a baby with whooping cough, it can be very scary seeing these fits of coughing where it looks as though the baby is going to completely run out of breath, and they might cough for a number of seconds, constantly coughing, cough, 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 cough. And then at the end of this coughing fit, they're so out of breath, they take in a characteristic deep breath in like that. And that's the whoop that gives whooping cough its name, that very characteristic whoop. So most clinicians through their training will have come across these descriptions or seen videos, even if they've never seen a classic case of whooping cough. It's so characteristic that those cases are relatively easy to diagnose. What's less easy to diagnose are cases in people who've got partial immunity from vaccination, in which case it can be hard to distinguish from other causes of coughing illness.
It sounds horribly frightening, and if you've been in contact with someone, lived with someone, or had a child with whooping cough, it's hard to forget that distinctive cough that leads to that gasping breath at the end.
That's right. Thankfully, that's relatively uncommon now, and that's largely because of immunisation. And especially over the past 6 or 7 years, immunisation in pregnancy. So women have been routinely recommended to have a dose of whooping cough vaccine towards the end of every pregnancy. What that does is provides their babies with antibodies. So the antibodies that the mum develops are passed to the baby through the placenta. And so the baby is already born with fairly good protection against whooping cough, not 100%, but very good. And so now, even before a baby has had their own first dose of whooping cough vaccine, which it should be given at about 6 weeks old, even if a baby who's a newborn gets in contact with whooping cough and they acquire it, they may not get the classic symptoms of whooping cough. In fact, they may be completely protected, or they might get a mild case. But because not every mum is vaccinated during pregnancy, and because nothing is 100% protective, we still occasionally see very severe cases of whooping cough.
You've taken the words right out of my mouth about pregnancy and vaccination. That's on the NIP, the National Immunisation Program, correct?
That's right. So whooping cough has been part of the National Immunisation Program for a long time. It's always been one of our highest target infections for vaccination, prevention with vaccination, because before vaccination, whooping cough was one of the number one causes of death for young children. Now, thankfully, not only in Australia but across the world, most children have access to vaccination, and that has had a profound effect on the number of deaths globally from whooping cough. The vaccine is very effective in reducing the risk of severe disease. It doesn't completely eliminate the infection. Whooping cough isn't that sort of vaccine. It's a vaccine that is designed to protect against the worst symptoms. And so it's essential, if we're to avoid these severe cases of whooping cough, that we have high levels of immunisation, not only of children, but also for adults as well, because even though adults are unlikely to have severe and life-threatening whooping cough, they can carry the bacteria and they can easily pass it from one person to another, including to young babies. So the cornerstone of protecting against severe fatal cases of whooping cough is high levels of immunisation in the community.
We are told frequently flu vaccine each year. Are we good at hearing that message about whooping cough? If you're in contact with a newborn, you must be boosted for whooping cough. I mean, are we good at doing this, Tom?
I think we're certainly much better than we were 10 years ago, and that's thanks to growing awareness. Now, speaking to young parents and family and friends, I know that a lot of expectant mums and young families are actively, requesting family members to go out and get a vaccine dose. So I think if we focus on that group, that's probably the most important thing that we can do. So if you're a grandparent or a expectant uncle or auntie and you haven't had a pertussis vaccine dose, especially if it's been more than 10 years, and for a lot of people that will be the case, then you should be going to your GP and asking for a top-up. And you should try to do that at least a few weeks before the baby is born or before you're likely to have your first contact with that baby.
Tom, vaccination as a prevention can be a complex area. We have a national immunisation program and it provides free vaccination for whooping cough for some times of your life. Can you run us through who should be vaccinated, when, and how often?
So vaccination really starts in pregnancy. Your first exposure to a vaccine should be when you're in the womb. So women are recommended to get a dose of whooping cough vaccine in the second half of their pregnancy. Ideally, at least a few weeks before the baby is born, the antibodies need to be generated, and that does take a couple of weeks for those antibodies to get up to their highest level. And when they're at a very high level, they can then pass to the baby through the placenta, and then the baby is born already with those antibodies on board. Then the baby should receive their first whooping cough vaccine as part of their first vaccine doses when they're 6 weeks old. So rather than waiting to 2 months, which is traditionally when the first vaccine doses were given, people are now encouraged to do it from 6 weeks old. They try and get those antibody levels up as quickly as possible. And then babies will routinely get a second vaccine dose as part of their 4-month immunisations and part of their 6-month immunisations. And you really need 3 doses to get good levels of protection against a whooping cough. Just 1 dose is not enough. The protection starts to wear off relatively quickly. So even by about 18 months old, 2 years old, your baby vaccine doses for whooping cough are starting to wear off. And so we now routinely give a booster dose of whooping cough vaccine at 18 months. And we also give a booster dose at 4 years old before kids start primary school. So kids need to get these booster doses through their childhood. And we now also give a booster dose when kids enter into high school. And then kids and adults are essentially recommended to have a booster dose every 10 years. So your protection improves and your personal risk reduces as you get old. But to try to reduce the overall community prevalence of whooping cough, it's good that people get booster doses of whooping cough every decade or so.
We talked about adult vaccination and prevention of disease on MatterofVax. I feel like a message that's not really getting out there enough is the one about adults being responsible throughout their life for getting boosters. You said earlier, if you know there's a newborn coming into the family, really as a population, we're exposed to people who are pregnant all the time. We're exposed to young children who may not be newborns but still very vulnerable. Do we need to send the message that adult boosters against whooping cough is something we should be thinking of as fairly routine in our life?
Yeah, I think people should know that it's recommended, and they should know that vaccines that they had as children don't last all their life. And they should also know that it's not just about protecting themselves. We also unknowingly come into contact with adults who are immunocompromised. We may come into contact with people who we don't know. They have cancer, they're on chemotherapy. Those people can be very susceptible to infections, and we should be thinking about what whatever we can do as adults to reduce the chance that we accidentally and unknowingly pass infection either directly to those people or indirectly. So I may never come into contact with a baby, but I might come into contact with a colleague at work who I accidentally infect, and that person might then accidentally infect their baby or a friend's baby. We talk about chains of transmission, and it's really important, even if we don't anticipate that we're ever going to come into contact with a baby, that you might actually come into a contact with a baby, but indirectly. Making sure that you're up to date with your own vaccines not only protects you, but also helps to break these chains of infection and protects the most vulnerable people in the community, especially young babies, but also people who are immunocompromised for a range of reasons.
Thanks for adding that very important point about immunocompromised Australians, something that's very dear to my heart. One last question for you is, what's next for Australia and whooping cough prevention?
So there have been some big changes in the past decade. We've introduced the adolescent booster dose. We reintroduced the toddler booster dose at 18 months, and we introduced maternal vaccination. I think we're still really evaluating the impact of those changes to the vaccination program. My feeling is that they have had a very big effect. Because we've had a number of years of low transmission, we've been waiting to see what happens basically under this new program. We're starting to see more cases now. So I think over the next year or two, we will really be looking hard to work out where the gaps are. Who are the people in the community who are still getting severe infection? And if so, why is that the case? And do we need to recommend or change the program, move where those vaccine doses are scheduled? Sometimes the only way you can answer those questions is to watch and wait, and then use modelling and other methods to work out, can we actually do this? Can we do this better? Do we need to introduce some sort of routine revaccination program for older people as well? So rather than just waiting for an older person to come forward for vaccination, do we actually say, okay, when you're 30 years or 40 years old, you have a top-up dose, or you have a dose with your zoster vaccine or your pneumococcal vaccine or whatever. So it's probably a little bit too early to say what changes need to be made, but the experience up until now has been that whooping cough is always evolving, and we need to be adaptable in our program. I think it's going to be a long, slow process to get even better whooping cough vaccines, but we're certainly hopeful that over the coming years we will have even better vaccines than we have now, so that we're not needing to revaccinate people every few years.
Tom, thank you so much. It's critical that we keep having conversations like this about immunisation in Australia. If you've been listening to this podcast, I encourage you to find out where you're up to with your whooping cough immunisation. Tom, thank you very much for joining us.
Thanks very much for having me, Steph.
You've been listening to MatterofVax. You can find more on this subject by going to ifa.org.au, where you'll see a video on whooping cough and other diseases as a part of this series. Thanks for joining us.